What are we doing right now? Well, I haven't got a graph to show you, but I think we're a pretty good example of what happens as we go through different phases of the program. When we started our redesign work in 2008-9, we had some rapid improvements from about 40 to 45% NEAT performance up to mid-60s or 70s with some fundamental but very simple low-hanging fruit sort of solutions. We had a big push towards a target by a deadline, and we actually sort of got to 85% for a short period in early 2010, and then we sort of drifted down as the focus sort of started to come off it. And then we went through a second phase of redesign where we did some of the more difficult things. And Royal Perth Hospital, I don't want to say languished, but we sat for almost 2 years where we were able to perform at the sort of the 75 to 80% mark, with peaking in 80% in the summer and drifting down to low 70s in the winter, and sort of being there. And we didn't really, although we improved year on year, we only improved by a few percent. And we sort of sat there for a while, and then we had a bit of a relaunch just recently, and we've made a big jump, which over the last 3 or 4 months has been sustainable, and now we're aiming to be consistently at 85 to 90%. So in April, the average for all our days in April at Royal Perth was 85%. We met the state target that month. May, 83%, and we're now coming into some winter pressures, but we're averaging June to date as of yesterday, we're averaging 83%. We have an identical admission rate, but we're now seeing 225 patients a day on average. On some days we can see 265. In the same emergency department that we could barely fit in 166 6 years ago, with the same staffing more or less. We now average, last 3 or 4 months, we average 95 to 96% of our discharges within 4 hours. And the mathematics is that we have to get a minimum of 70% of our, or 65 to 70% of our admissions in within 4 hours. And we're doing that, and I'll show you in a second. Our access block, which was 50% in 2008, is now consistently less than 10. We measure it by day. We have days where it's 0. We have days where it's 12%, but we're averaging less than 10. And that's that same corridor now. In fact, we've put storage along there now so that we can't have patients there. But there hasn't been a patient in the corridor since 2011. This is the report for Sunday. So Sunday we had 229. We had 77% of our admissions within 4 hours. We had 90 admissions that day. And we got 98.5% of our discharges in 4 hours. And somebody will be following up those two to find out if there was a problem why they couldn't be discharged shorter than that. Likely to have been a mental health patient, I think. And you can, well, it is. There it is. It's down there. Mental health we demarcate separately. It was a mental health patient that didn't get discharged. I'll just show you the next page because you can't really see it if you put it all on one page, but this actually goes down to a second page where we actually say at the top, if we wanted to reach 90% that day, how many more patients would we have had to have gotten in 4 hours? And on this particular day, we missed out by 2. And those 2 people had an average breach time of 16.5 minutes. So we're about 16 minutes away from getting 90% that day for 2 patients. But then, this is very important, and you'll see why later, for every ward or unit that takes patients, we measure how they got their admitted patients in within 4 hours. So, for example, the acute medical unit took, where is it here, took 16 patients and they got 14 within 4 hours. This is the next day, Monday, and we're only 77%. And you can see that, so this is the day before yesterday. You can see that we still got 90 95.8% of our discharges within 4 hours. But this is to show you that we haven't cracked it yet, because Monday's not the same as a Sunday, which is not the same as a Thursday. And a lot of the work we've been doing recently has been about what Professor Derek Bell from the UK calls creating headroom on the weekend so that Monday is a normal day. Now, Mondays 3 months ago was 65, but we're now 77 on a Monday, which is a bit better. But I wanted to show you that the ED performance in terms of discharge is pretty consistent. We had 247 on Monday, and they had 5 people that didn't get out within 4 hours from a discharge perspective.